Dr. Tom Roselle live right now, 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I am live in studio on this windy but very sunshine Washington day. Love to take your phone calls at 888-630-9625. That's 888-630-WMAL. Let's talk about what you want to talk about, although we have a subject that I think you're going to be very interested in finding out a whole lot more about, and it's going to be the subject and topic of our in-house continuing education program this coming Wednesday evening at 7:30 at the Roselle Center for Healing. And the topic is the treatment of cancer and chronic diseases with acupuncture. That's going to be this Wednesday, the 20th of April, 7:30 p.m. at the Roselle Center for Healing. And if you'd like to attend that program and find out more about this fascinating area of application and treatment, acupuncture, as it treats cancer and chronic diseases of all sorts, give our office a call at 703-698-7117. That's 703-698-7117. I want to remind you, and I would like to encourage you for the first time, and you can go to our website to find out all the details. Coming up September the 17th, is Ageless Health 2011, a comprehensive look into wellness healthcare and how to change your life. This year's program will be sold out just like every year in the past, and it is going to be dynamite. It starts early in the morning and it goes to late at night, and we want you to be there as our guest. It's going to be a topic that's going to focus on the ultimate solution to America's healthcare crisis. You're going to discover things that will dramatically change the state of your health forever. 5 vitamins, for example, that you have to take if you have any hope of staying healthy. You want to avoid things. There's very specific punch lists. There's 10 things to avoid to prolong your life and to live much older, and how to protect yourself against radiation with the Nakashima meltdown. That's a concern to all of us. We're going to teach you how to do that. Exercise is the fountain of youth, but specific exercise, and we're going to teach you about that. And we're also going to teach you something very curious, how healthcare reform can save your life. Topics are going to be great: power nutrition and perpetuation, the power and capacity of the brain at any age, structural integrity of your immune system. Wellness begins at birth. You know, that's the time to really turn it around. Athletes at home and in the industry, and how to exercise, and also application and efficacy of acupuncture. It's going to be held at the Fairview Park Marriott Hotel. You're going to have all the coursework to take home on a dish. You're going to have an organic lunch that is going to be included in your registration fee. There's going to be a gift bag. It's an amazing day, and as well $1,000 in drawings, special gift for all of you. Between now and I think it's the middle of June, you can save up to 15% on registration, and after that it goes to the straight price, and there will be no discounts after that. I got beat up for it last year, so guess what? It's not going to happen. So if you'd like to take advantage, you can either go online at RoselleCare, RoselleCare.com, and you can register right online, or you can call us at 703-698-7117. You can register either way, but if you'd like to save 20% and you know you're going to attend, and I encourage you to do it now. Do it before we're all sold out, because we're going to explode this thing this year, and it's going to be far, far better than anything that we've done before. And last year, was rock and roll time. It was a great day, and it's going to be fantastic. Let's get into our subject, and anything that you'd like to talk to, remember, call us at 888-630-9625. That's 888-630-WMAL. My guest today in studio on this beautiful day is someone who knows the subject probably better than anybody else, Dr. Stephanie Pina. Hi, Doc.
Hi, how are you?
I am well. We're going to talk about cancer and chronic diseases today and try to help people out. So the question starts out is this. We're talking about acupuncture. In 1976 in this country, thanks to Richard Nixon opening the door to China, we began to explore the intimacies and the intricacies of acupuncture and the applications and what can be done and so forth and so on. So 20 years after that, the Food and Drug Administration said, this is really cool, and acupuncture devices became part of the medical community. But we learned very rapidly from a science that is 4,000 years old that it has a significant effect on the body's ability to repair itself, particularly when it comes to cancer, which a lot of people wouldn't think about, but more and more traditional institutions are applying its application, and whether it was to control initially vomiting and nausea and so forth, the side effects. But what I want to start out with, Dr. Stephanie, start talking to me about, and talk to our audience about, how does acupuncture really affect these conditions? I mean, we've talked about qi before, the imbalances and the energetics in the body, but how does it really, really work?
Well, with acupuncture, anytime you talk about how it affects qi and energy in the body and blood flow, essentially it's really coming down to affecting that cell-to-cell communication. And in between those cells, anytime when they're acting properly or they're dysfunctioning, like in cancer or chronic diseases, essentially there's a miscommunication between maybe some hormone responses or the chemicals that the body's basically sending out to those cells. The acupuncture can go in itself and essentially correct some of those miscommunications, so it can either turn things on or turn them off and essentially promote either more blood flow or electrical flow to areas where there might be misfunction going on.
So we know that there are different hormones that protect us, there are different hormones that build us and repair us, and often when people get sick, these things are suppressed. The immune system, as we say, begins to debilitate itself, so we become suspect to all these other things. But it does affect the neurological pathways. It boosts the immune system. It stimulates something that we call endorphins, which controls the pain. So a patient that comes in, and we know for example, the American cancer hospitals use acupuncture, they use herbs, they use nutrition in addition to other types of procedures to treat cancer. In our experience over the years, we've had patients who've come in with lung cancers and so forth, and we've treated them in cooperation with other things that they were doing, and the results are profound. Your experience and things that you've witnessed and have done, how significant is acupuncture in the treatment of different kinds of cancer specifically?
It's always growing as years go by. Essentially, they did a study in 2004 and 2005 that said that 7 to 36% of cancer patients are actually receiving either acupuncture or some form of complementary and alternative medicine along with their conventional medicine treatment at the same time. And as more of the conventional medicine facilities, which see mostly cancer, have more patients come in and they get more involved with the other issues of cancer treatment beyond just the treatment itself, looking at the mind-body connection, looking at some of the side effects that essentially happen to cancer patients, and even after they finish their treatments, what happens after them as far as support. You see a growing use of acupuncture, whether it's stress release or to actually help build the body back up and to help prevent things for the future.
You know, acupuncture controls pain, and there's no doubt about it. We've used it for many, many, many years to do just that. A patient comes in and they have whatever type of pain, migraine headache, or they have phantom limb pain, or they have the pain of fibromyalgia. Acupuncture is significant in controlling those pain patterns. There's no two ways about it. I've used acupuncture for 35 years of practice, and we see phenomenal results. But here's a very specialized application. We have patients who come in who are being treated for pulmonary problems that are a result of cancer. We have patients that come in with ovarian and uterine cancer. And not only do they stimulate the natural killer cells and lymphocytes within the body and increase blood counts, but the effect of healing is amazingly significant. Patients turn around much faster utilizing acupuncture than they would if they were treated otherwise.
Yeah, essentially what we see happening with cancer patients when they come in is essentially they are having such a specific treatment when they go in for whether it's chemotherapy, radiation. And a lot of the times, while those treatments are affecting the cancer themselves, there's a lot of side effects and stuff that don't get addressed, or they have to take another medication on top of that in order to address it, just like using anti-nausea drugs before doing a chemotherapy treatment. And that in itself can wipe out a patient. If the patient's not in a strong, healthy kind of format and they're not able to deal with their stress of even going through the whole procedure, things like acupuncture and herbs can be used to basically help support that system while they can focus on using some of those other medications for those direct targeted kind of therapies.
We're here at 888-630-9625. That's 888-630-WMAL. My guest, Dr. Stephanie Pina, acupuncturist and doctor of naturopathy. We're talking about the treatment of cancer and chronic diseases with acupuncture, its effectiveness in pain control, which is, you can't argue about it. It's there. And the National Institute of Health and the FDA and everybody else is jumping on board with this. And this young doctor who is with me right now has significant insight into this. There's the side effects of chemotherapeutics and radiation, and here's an application that I've known for forever. How does it affect the side effects, the hair loss, the nausea, the body pain that goes along with some of these, in my opinion, barbaric traditional treatments of cancer?
A lot of the times when you use these agents or you're using radiation, it's so focused on one particular area, or it's so focused on that one organ system. So all the focus that goes there sometimes draws all the energy out of the person. As far as like with hair loss and even fatigue and even looking at increasing red blood cell numbers, the acupuncture can help stimulate the system to bring everything back into balance. So they know that it can stimulate the chemicals in the body that we normally produce to, say, produce more blood cells, even if we were having, we were hemorrhaging or there's a bleed and we need to produce more blood cells. It can work in the same way. Essentially, with pain, what it does is it also promotes bringing oxygen and blood flow to those areas where there may be damage to the tissue around nerves, around blood cells, or around the tissue organs that are being treated. So in the case where there's excessive burning from radiation treatment, essentially it can help bring nourishment back to that tissue underneath to help prevent loss of function in that area after radiation.
Acupuncture is amazing. It's something that has caught my attention for many years. Even when I was in the clinic, I had the opportunity of studying with what's affectionately called a traditional barefoot doctor, a guy who has practiced acupuncture and herbs and traditional Chinese medicine basically since he was a child. And I learned things at his hand that I'd never seen or thought about. And since all the years I've been in practice, I've been able to help many patients cooperatively with other people. But it's truly profound when you see a patient. For example, I had a patient who came into us some years ago, had cancer. He was diagnosed with cancer in his lung, and they wanted to do a procedure where they were going to take the lung out completely, then give him chemotherapeutics and radiation and so forth. And the guy said, no, there's no way. I'd rather, go through and check out. And he came in and he says, is there anything you can do for us? I said, all we can do is support your body's system. Well, we began to treat him with herbs and acupuncture and so forth to bring his immune system back in. And he goes back to his physician I think it was about 9 months later, and they re-examined him, did another PET scan on him, and there was no sign of the cancer. So does that happen in every case? Nothing happens in every case, but here is an absolute demonstrable clinical study that says it works. Something took place to change this man's whole life. We're going to talk more about that. Dr. Stephanie Pina, my guest, your host this Wednesday evening at the Roselle Center for Healing. If you'd like to attend her lecture, 703-698-7117. Don't go away. You're listening to Dr. Tom Roselle Live. We are in studio at 888-630-9625. That's 888-630-WMAL. I'm talking about a very fascinating subject, one that has got my attention for many years because things change dramatically when you use acupuncture when it comes to cancer and chronic diseases. My guest, Dr. Stephanie Pina, your host this Wednesday evening at the Roselle Center for Healing, the 20th of the month at 7:30 p.m. Dr. Pina is going to be talking about the application of acupuncture and chronic diseases and how you can really turn these things around. Acupuncture, Dr. Pina, has, by the American Association of Medical Acupuncture says that acupuncture is not a palliative treatment. It's curative. And they have other things that they list as palliative. And believe it or not, they list palliative as chemotherapy and radiation and so forth, but they put curative and they list acupuncture. Why? How does acupuncture set its aside that way? And is it best as a standalone therapy or is it best in combination with traditional treatment?
Well, I think one of the things when it comes to cancer treatment is you always have to look at each individual factor. So if a patient comes in and say they're in an earlier stage of cancer, like stage 1 or stage 2, where there's limited spread, they pretty much know exactly where things are going. It's going to be a better source to if you want to just use acupuncture or alternative medicines by itself, but you still want to be active with your oncologist and essentially, communicating back and forth using their basically their skills and also their ability to image things to kind of track what's going on. When you start getting into more of the upper stage cancers and more terminal cancer, then you still want to ask the patient what is in their best interest. Is it best to treat them with something like acupuncture as more of a palliative care, so more as a, on the side, or is it to, if they can't find something to treat them with, can you use it by itself, or do you combine it with conventional therapies as well?
888-630-9625. If you have a question for Dr. Stephanie Pina, if you'd like to attend the class this Wednesday evening, the 20th, 7:30 p.m., you can give us a call at 703-698-7117. Before we go too much further, we have some calls lining up, and I don't want to be negligent. Bill, thank you for waiting so long. How can I help you, sir? Bill? Hello?
Hello?
Sir, how can I help you? This is Dr. Roselle.
Good afternoon.
Hi, how can I help you? Bill?
Hello?
Yes, sir. Well, we can't get a hold of Bill, so we'll have to try again. Give us a call at 888-630-9625. That's 888-630-WMAL. We'll check the switchboard. Dr. Pina, this Wednesday evening you're going to cover some very specific topic areas. And how are you going to interrelate all this? What are you specifically going to show our listeners as far as how acupuncture can handle cancer?
Well, some of the great things is that some of the larger cancer treatments that see a variety of different types of cancers, essentially they've been putting out more information and doing a lot of research that whether it's the layperson or the healthcare professional can understand. We're going to go through some of that modern research that they've been doing the last 10 or 20 years and to see how acupuncture has been used more frequently in the center, outside of the center, and how they're kind of trying to explain how acupuncture works in the body, whether it's for treating nausea and vomiting or pain or essentially improving the immune system so that there's more white blood cells and red blood cells count, which might be a side effect from their actual treatments itself at the cancer centers.
Here's an interesting situation. The Thermography Centers has always been an ongoing sponsor of Dr. Tom Roselle Live, and Thermographic Imaging can show not only the beginning stages of cancer, but interestingly enough, when you use acupuncture, and you can begin to see the acupuncture change the thermographic signal on this type of diagnostic pattern. It's amazing to me, whether it's a pain pattern like a torn tendon in the body or whether it's a bronchial condition of the chest or whether it's cancer. You take an image of the heat signal that's being put out by the body that would suggest whatever it is, and then you stimulate the energetic system with acupuncture, and you can see right in front of you, it's literally in a matter of minutes, you can see the body change, and change quickly. It's profound, and it's one of the tools that we like to use because it actually documents the reversal of things, and later on the things are no longer there, they're gone. And by the way, thermographic imaging, if you're interested, and you should be, and you should incorporate it, the Thermography Centers of Fairfax called Dareth Painter at 703-943-7248. That's 703-943-7248. Make it part of your annual examination because it's going to point things out to you when you have a chance of actually doing something about it, not waiting till it's too late and you can't reverse anything. If you're listening to Dr. Tom Roselle Live, we're at 888-630-9625. That's 888-630-WMAL. My guest, Dr. Stephanie Pina, acupuncturist and doctor of naturopathy. We're talking about the use of acupuncture with cancer and also other types of severely chronic degenerative diseases that just don't seem to respond or respond minimally, or the side effects of treatment are worse sometimes than the treatment itself. Having said that, let's go back and see if we can find Bill again. Bill, can you hear me?
Yes, hello.
Okay, good. I'm glad you're here this time. How can I help you, sir?
Okay, I had an outbreak of shingles 2 weeks ago. Pretty bad outbreak.
Okay.
It's healing now, but the pain is unbearable, meaning I can't function.
Okay, Bill, how old are you?
50.
Okay.
Well, we know that shingle outbreaks essentially have to do with the nerve function, and essentially that virus gets into that nerve and essentially can spread out from either the central area and then go throughout the rest of the body. With this type of pain, what are you still feeling right now as far as is it sharp or shooting?
Stinging and the burning.
Stinging and the burning. Is it in a certain area of the body?
Yes, it's right under my armpit on the right-hand side.
What have you done for it so far?
Took antiviral medication and
it's not working?
taking Oxycontin. They are healing, but the pain is still there.
Bill, in my experience over the years, acupuncture works significantly well for that type of problem. The pain can be modified from the first application, but you have to treat it consistently.
Meaning you have to do it all the time?
No. Until you get the system to heal up. The virus can be controlled. Things that also can be used is our herbal preparations, vitamin B12 and folic acid, high levels of vitamin B1. All of those things work well. And when I say high levels of B1, I'm talking about 1,000 milligrams a day. Divide the dosages up. The B12 with folic acid, B12 in the neighborhood of about 12,000 international units a day, and that begins to modify the inflammatory reaction.
Prescription for those?
No.
Such high dosage, no?
No, you can get them. You have to take enough of them. Generally, though, any of those things you want to have them evaluated by somebody like us who does that type of work, and it can be very, very significant in the effect relative to pain control and also promoting healing. Vitamin C is an antiviral. L-lysine, L-Y-S-I-N-E, also is an antiviral, and you would take 4,000 to 5,000 milligrams a day or 4 to 5 grams a day to try to control it. And it's usually a combination of things that will do the job, but it does work, and we've treated many patients with it.
This is for the pain you're talking about, or the healing of the whole thing?
Both. And you can't do one without the other. Acupuncture will control the pain dramatically, but it also perpetuates the healing process. If you don't get it under control, it can come back. And
if I have pain, it means the infection is still there. Hasn't healed completely.
That's correct. The nerves are still hot. The virus is still there. It's just that it's suppressing it, subduing it enough that it's not on the surface. But as long as you can feel the pain, you can feel the burning, the outbreak can occur again. It's just like any shingles is like herpes. It's there underneath the surface, and you have to bring the body's immune system up to the place where it's strong and it protects you and it begins to deal with it. Viral patterns are very difficult to heal, but they can be totally controlled, and it has to be done the right way. Bill, if we can help you, please give us a call, and you can get a hold of Dr. Stephanie Pina. We work together as a team, and much can be done for you. Thanks for your call, Bill. I appreciate it. This Wednesday evening, Dr. Pina, you're going to be talking about a lot of different things, including pain patterns like this, and whether it's a herpes condition or it's a shingles condition like this, or it's cancer. The approach is similar in that we're trying to stimulate the body's immune response. Is that correct?
It is, and essentially also part of the healing process is also to decrease stress that's essentially, stressing out the body and essentially bringing on more pain too. By increasing the immune system, what we're doing is trying to get the body to recognize where the pain's coming from, how we're responding to it, and also looking at how people respond to stress and pain differently. Whether it's, a shingles outbreak or a cancer treatment, people are going to respond differently, and they also might have other lingering conditions that need to be addressed in the meantime, or were there factors that brought on such things like the herpes and the shingles as well.
It's unfortunate. People are locked into a paradigm that nothing can be done for where they're at. But the truth of it is that so much of what we see, where you are with your health, is a result of many exposures, many things you've done, things you've failed to do, things that you thought you were doing properly, but unfortunately you've been duped over the years because of Fifth Avenue marketing. And it takes its toll. It builds up over time. But here you have an application, a procedure that has worked for thousands of years in its primary essence. I mean, we're talking about an absolute area of healing all within itself. And we're talking about cancer, we're talking about degenerative diseases. I want to go to the next caller. Kind of on the surface, it's off the radar screen, but not really once we get into it. Bobby, are you still there? Bobby.
Certainly am.
Hi,
Yes,
thank you for calling. You got a problem with yeast, or you have somebody who has a problem with yeast? What's the question?
Yes, my daughter lives in the Caribbean, and she, over the years, I'll just give you a little bit of history about it, has had a number of intestinal issues, as you can imagine, with the parasites and things.
Absolutely.
And so she's been on and off metronidazole and I don't know what else maybe. So she's seeing a natural health doctor down there, and they're telling her that she has 2 types of yeast. And she was telling me that they told her that the yeast starts in the intestines, gets into the bloodstream and the organs, and could result from prolonged antibiotic use. And they're treating her with a natural antifungal medicine. They've also mentioned ozone therapy, where they take blood out and put the ozone in and put the blood back in the body, and also radio frequency.
Yeah.
So I don't know if you could, with your great vast knowledge of natural medicine, could maybe, and let me mention one other thing. Her children, both of them have sinusitis, and she was wondering if either ozone therapy or the radio frequency, they're getting some kind of shots in their umbilical cords or something right now, and that seems a little severe, and she was wondering if either of those therapies might help with sinusitis as well.
All of those things can work well, Bobby. It depends on the condition and how they're treating. The bottom line is that you have to look at the environment, too. Living in the Caribbean, it's damp, it's nasty. It's like guys that, in my generation that fought the war in Vietnam. They came back with jungle rot that was ridiculous, fungus, and many of them carried it for the rest of their life. But you have to have an environment that is susceptible to that, meaning one that is more acidic, one is more sweet. I'm using that, and that's not the terminology, but it gives you the idea. Funguses grow in damp. They grow in environments that feed them, dairy, sugars, things that convert into sugar very, very quickly. And you have to eliminate those things totally. The area of application that you were talking about, where they withdraw the blood and then they irradiate it and so forth and put it back. It's an area called biophotonics, and it's where they take a low energy light laser, they pull the blood out, they hit it with a certain frequency, then they inject it back into the body, stimulating the body's immune reaction to deal with it. It works. It's really good stuff, but you still have to change the rest of that, meaning the dietary patterns. You have to go after the intestinal tract. Most yeast problems start in the gut, but not necessarily all of them. If the external shell, the skin, is susceptible as well, it can come in from the outside and begin to change the body's immune function that way. In addition, you go down to South America, they have a herb. It's actually a bark from a tree. It's called Paudiarco. It's a Paudiarco, Ipsirola, Pacho. It's all the same stuff. And what they do is they take this herb, the best stuff comes from Argentina, and they grind it up into fine powder, and they can make poultices out of it. They make teas out of it. They can make pills out of it. But you have to, even with that, you have to do other things. So it's resolvable. The oxygen therapy that you're talking about can work. This country years ago, they first started doing hydrogen peroxide therapy, food grade, to kill yeast and mold, and that had an effect as well. But it still comes down to you have to change the terrain, the environment of the person. Otherwise, everything that you do is for naught. It'll come back. It'll change it in the short term, but in the long term, nothing's fixed. Does that make sense to you?
Yeah, they did tell her not to eat sugars, like even fruits and things like that.
Correct.
Not to have sugar, and just vegetables, primarily with some meat, and so they did address that a little bit, and it does make great sense to me. Did I hear that you're doing something at your office on Wednesday?
This Wednesday evening, Dr. Stephanie Pina, my guest today, is going to be doing a lecture on chronic diseases, the application of acupuncture in chronic patterns. Basically how the body is stimulated with acupuncture, but also with cancer therapies and the like. Cancer and fungal conditions are two of the toughest things, and it's kind of the last stage where the body's breaking down. But it's in both cases, you're going after immune stimulation. You've got to reverse the body's terrain. You've got to reverse the energy pathways. You have to strengthen the biochemistry. If you do those things, life changes and the patient heals. And the hardest part is getting the patient to do what they need to do.
That's at your office on Wednesday?
At our office, 7:30 Wednesday evening, the 20th, this coming Wednesday.
Okay.
And all you need to do is call our office at 703-698-7117. Tell my staff you'd like to attend. The class is free. We just require a reservation because once we're full, we're full. Okay?
Well, my daughter's going to be in town, and she's studying nutrition, so that's right up her alley. So I'm sure I'm going to call. Are they there now?
No, they'll be there, but you can call and leave a message, and they will call you back first thing in the morning.
I'll do that.
Bobby,
thank you so much, Doctor. Thank you for all that you do.
You're welcome. I appreciate it. Ralph, how can we help you, sir? Thank you for calling.
Question on multiple myeloma. I'm sure you guys know what it is, but showed up the other day, and I want to know what we can do other than try to burn it out or chemo it out or a bunch of other things. I know the survival rate, at least statistically, is not that great, so assuming that there's no cure, but that's the AMA telling me there's no cure.
That's right. Well, how old are you?
65.
Okay. And where did they find it? Which bone areas?
Well, technically speaking, they haven't. They got to punch me on Wednesday, but a couple of people I've seen, one guy's always been straight with me. He says, yeah, it might be something else, but I'm pretty damn sure that this is what it is, and we'll just confirm it.
Well, the medical treatment's no fun. You're dealing with radiation, you're dealing with chemotherapy, you're dealing with stem cell therapy, which they've got to destroy your immune system to use it. So it's a bone disease, as you know. It's a bone expansion problem, but in our experience over the years, and I have quite a few patients who have multiple myeloma, we treat them to support their immune response and their neurology and to make sure things stay well balanced. The response is actually pretty good.
Yeah, really? Okay. Not to be morbid or anything, but what kind of extra time do you guys seem to buy out of your methodology?
Well, let's talk about it a little bit more, and then we'll give you that piece too.
With multiple myeloma, just like a lot of cancers and stuff, the more information you have on it, and the more sites that we know that we have affected, the more severe it is, and that's when they start talking about some of these, aggressive treatments and stuff. With acupuncture, with alternative medicine, nutrition and stuff, can essentially kind of help decrease the immune system that's overacting, and then boost the immune system to help prevent some more of these newer plasma cells from essentially affecting the cancer itself. One of the main things that you see with this also is just typical bone pain everywhere, and they can be pretty severe bone pain. So whether you're treating just the pain locally or you're also affecting the whole system, acupuncture can be one of those things that essentially can be used to kind of help regulate the system, and it can be used by itself or together depending on which state you are in. So the more information you find out, the better.
What I can tell you is longevity and your morbidity, your quality of life is dramatically extended by using alternative methods with multiple myeloma. I appreciate your call. Give us a call at the office, 703-698-7117. We'd be delighted to help. You're listening to Dr. Tom Roselle Live, 888-630-WMAL. That's where we've been, and that's how you've gotten a hold of us. My guest in studio today has been Dr. Stephanie Pina, acupuncturist and doctor of naturopathy. This Wednesday evening, she is going to be your host at the Roselle Center for Healing, and the topic is going to be chronic diseases and cancer through acupuncture. If you're suffering with a problem that hasn't gone away, if you have cancer, if you want to know how to deal with the side effects of some of the traditional treatment you're going through, chemotherapy, radiation, and so forth, you can control that. It can make a huge difference. You can assist that and turn your process into something that actually will work for you. The studies are out there. The research is coming in and has been coming in by the droves, showing that acupuncture works for cancer therapy and for chronic diseases that just don't seem to respond to anything else. This Wednesday evening at the Roselle Center for Healing, 7:30 p.m., we'd like to invite you to be our guest. Please attend. All you need to do is call 703-698-7117. That's 703-698-7117. Tell my staff that you would like to attend Dr. Pina's class this Wednesday evening. And there's absolutely no charge to you. It is our gift to the community. All we require from you is a reservation because we only have limited spacing. And when that's full, we're done. And we're going to have to tell you, I'm sorry that you can't come. So please give us a call at 703-698-7117. Dr. Pina, couple minutes we have left, go through and tell our audience why they should attend. If they have the problems we're talking about, how's it going to benefit them?
Well, anytime you're facing either cancer or a chronic disease, the more information you know, the better, no matter which kind of practitioner you're talking with. Essentially, getting that information can also help you lead to making better decisions about how much involvement you want to be involved with, what kind of steps you want to make now in the future, and also during treatment or after treatment. So essentially, the lecture is going to go through the different stages of chronic disease, why we get chronic diseases and how our body responds to it, and then how acupuncture and Chinese medicine has been used not only in the past and how we've learned from things as far as clinical trials and also treatments, on how the body can respond better. How can you get your life back into step?
You know, there are very few things that impress me. And I've been at it too long. I've seen everything from one end of the spectrum to the other. But the thing that continues to impress me and impress upon me is the body's ability to heal itself. And particularly with acupuncture, when you're changing the energy pathways, you're changing the central core, the energy of the body to be able to step up and do what it's supposed to do and what it was designed to do innately. It's incredible. This is a presentation that's going to give you a different look. It's going to kind of open the paradigm for you a little bit. And if you have any of these problems, I would really encourage you, get the data, get the information, because the more that you're willing to step up and be part of the process of reversing whatever you have going on, the more likely it is that you'll be successful at it. Dr. Stephanie Pina
Want a chance
will
to
be
see
your
Sarah
guest.
Palin live and in person?
Dr. Stephanie Pina will be your host this Wednesday, the 20th, at 7:30 p.m. Love to have you as our guest. Give our office a call at 703-698-7117 and ask her anything that you'd like to have. Dr. Pina, I'll see you there, and hopefully our listeners will see you there too. We're here every Sunday at 12 o'clock, bringing you the most up-to-date information on integrative care. This is Dr. Tom Roselle. Bye.
Hi, this is Dr. Tom Roselle. If you're looking for a wellness and healthcare environment to showcase your business, products, and services, consider being a wellness partner of Dr. Tom Roselle Live and the Roselle Center for Healing. From in-show advertising to on-site events and digital marketing, we have several offerings that can highlight your business with a well-received and established audience. For more information, visit WMAL.com, keyword Roselle, that's ROSELLE, and click on Become a Sponsor. Health is a do-it-yourself program. That's reality and the title of my new book. This is Dr. Tom Roselle. Health is a do-it-yourself program is a most understandable introduction to natural health care. My book will take you step by step through why the body breaks down and gets sick, but also how it repairs itself. You will finally understand the often confusing world of natural care. Order it today by going to Amazon.com or from our website, RoselleCare.com. That's RoselleCare.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.